You're listening to Be Health Connected, a podcast by the St. Louis Area Business Health Coalition. Your host for today's episode is Laurel Pickering, BHC President and CEO.
Hello, I'm Laurel Pickering, and welcome back to the BHC's Be Health Connected podcast. Today, we have a compelling episode focusing on weight management and medications. GLP-1s are a class of medications generating tremendous interest and a lot of buzz for their efficacy in weight loss and cardiometabolic outcomes. But they are a big challenge for employers. And recently, I had a conversation with a large employer who said GLP-1s and specialty medications are keeping her up at night more than her medical spend, which I think was very telling. So, through this conversation, we will explore the findings, eligibility criteria, supply challenges, cost management implications, and more. All things GLP-1s. We'll discuss the impact of GLP-1s on employers and strategies that they can adopt to navigate this evolving healthcare landscape. To provide insight on this topic, we are thrilled to be joined by Florencia Halperin, who is the Chief Medical Officer with Form Health. Dr. Halperin, thank you so much for being here.
Thank you so much. I'm thrilled to be here, and these are topics I'm very passionate about. So I'm delighted to speak with you about this.
Well, thank you. Well, let's start having you tell us a little bit about your background and your journey and what brought you to Form Health.
Great. Thank you so much. So I trained as an endocrinologist. So I did internal medicine and then endocrinology. And I'm still in Boston. I was at Brigham and Women's Hospital, which is a large academic center affiliated with Harvard Medical School. And when you train to be an endocrinologist, you get 2 years to do research. And so my research started out with an interest in how obesity and diabetes interact in different treatments. And I was very lucky to be part of a randomized control trial that was comparing people who were undergoing surgery versus what medical weight management programs who had obesity and diabetes. And when you're the research fellow on these studies, you follow the subjects very closely and you fill out a lot of forms. And I got to be with these research subjects for years as they were undergoing these incredible weight loss journeys. And I like to tell all of this because I like to emphasize how much targeting weight is really about health. And what happened was I saw how losing weight was really driving incredible health benefits for these people. We were able to take away insulin. We were able to take away blood pressure and cholesterol medicines. And though it was making an amazing difference in their life. So they were saying things like, I can get on the floor and play with my grandkids now, and I can make it twice around the lake that's near my home. And so it's not just about the impact on their health, although that's tremendous. It's also on the impact that people feel in their well being in their lives. So I became very passionate as sort of using weight as a way to improve people's health. And I was very lucky because this was a field that was also rapidly changing at that time. So it was so interesting, kind of from an academic perspective. And so, working together with Brigham and Women's Hospital, I had the opportunity with a surgical colleague to be the founder of their Center for Weight Management and Metabolic Surgery. And at that time, I was also the chief of endocrinology at Brigham and Women's Faulkner Hospital. And our center was there. And we had a tremendous program going. We were treating patients, designing a novel program, and doing research and training future physicians and registered dietitians and everything else. And it was a patient who one day asked me if he could introduce me to a young, smart entrepreneur who was very interested in the field of obesity. And that's how I got connected with Evan Richardson, who is the founder and the CEO of Form. And he had such incredible ideas about delivering high quality evidence based obesity care, like we were doing in the hospital, but delivering it all through the little computer in everybody's pocket, as he said. So the idea behind Form Health was always to treat people through telehealth and always to do evidence based obesity care. And I do like to say this was in 2019. So this was before we had heard about COVID. And this was also before GLP-1s were on the news. And we will talk more about this. We did have GLP-1 medications then, but they were not on the tip of everybody's tongue or at the top of every employer's expense list as they are today.
Well, there's a lot to unpack there, especially which we'll get to in the rest of the podcast, is the impact on health when you do lose weight. And that's something that employers are struggling with right now is what is the return for the weight loss for my
Mhm.
patients? Um, so what is your recommended approach to weight management? And how do medications fit in? And this is where I think you should tell the audience a little bit about what Form Health does, so they know the perspective that you're coming from before we really dive into talking about GLP-1s. And my understanding is that we can think about Form Health as the centers of excellence for obesity and weight management care. But tell us, what is your recommended approach and how does that jive with what Form Health does? And why are you so excited about it?
Excellent. Great. So I think what's really fundamental to understand about obesity care is that it is driven for health motivation. So the idea is that we're improving people's health, not that we're helping people get to a specific number or a specific, bathing suit size or anything like that. We're really trying to achieve health outcomes for people and prevent a lot of the diseases that are associated with obesity, which is more than 200 conditions. You're at greater risk if you have obesity. So that's fundamental. And as far as treatment, we really embrace a comprehensive approach. So we talk about four pillars: nutrition, physical activity, mindset or behavior change, and medications. Surgery is also a very important treatment. I'll focus less on that since we're medical specialists and we do counsel people on surgery and help them get there. We treat a lot of patients after surgery, but we are not surgeons who perform the surgery. So, the reason these pillars are so important, I like to think of it as multiple tools in the toolbox. We cannot just hand someone a prescription and expect them to change their lifestyle and drive all the health benefits that those prescriptions can drive. We are learning so much about how just changing your diet, eating more fruits and vegetables, eating less processed foods, that in itself drives tremendous health benefits. Exercise is being talked about as the single most important thing that people can do for their health. And we have so much scientific evidence now to support that. So we're really trying to arm people with all of the tools and help them form a healthy lifestyle in addition to using medications when it's appropriate. I also want to say I don't think every single person needs medication. So we do a very comprehensive assessment. We really get to know the individual, and then we make a very individualized plan that works for the person that addresses all of these pillars, also stress management, also sleep. It's really a healthy lifestyle that we're after kind of helping people.
Great. That's really helpful for the audience to understand a little bit about the perspective and how you think about weight management. You did say that GLP-1s are used for patients when it's appropriate. So, can you talk a little bit about how you think about appropriateness for a patient and the use of GLP-1s? And then and then let's start talking about sort of their efficacy from your experience, and then any notable research that you can share or that you look to when it comes to the medications in particular.
Great question. And I will first sort of back up a little bit because you had asked me also a little bit about form. So I'm going to sort of couch the GLP-1 answer in how we think about things at Form Health. As I mentioned before, we're fully telemedical obesity care services, and each of our patients works with a team. The lead of the team is a physician that has American Board of Obesity Medicine certification, and then everyone also works with a registered dietitian who really helps put into place the plan for those other pillars. So, as far as medications, it's really through an in depth evaluation that the team conducts on the patient that we make treatment decisions. We are very focused on their health. So, we would, for example, do a lot of screening labs to understand how weight might be impacting this person's health. There are many medications that actually promote weight gain. So, we may try to work with someone to see if there's a better medication along in the same class for the same indication that could help them to not be gaining weight. So we would consider all of those things. And then for some people, we would consider medications. And I also want to say GLP-1 receptor agonists have gotten so much notoriety, but they are not the only class of medication that can help people lose weight. So, one of the things that's important about form is that we do consider the full spectrum of medications. And we'll come back to this because it's one of the really important cost saving strategies that not every person who gets obesity care gets a GLP-1 medication. And so we can help a lot of people in a more cost effective way and pick the right people for the treatment. So GLP-1 medications, let's just say, have really been a revolution in this field. The first GLP-1 came out in 2005. So these are not actually really new. I have almost 2 decades of experience prescribing them. But the first versions on the market were for diabetes, and they were much more difficult to take because you had to do 2 injections a day. The newer ones are much more effective. Some target GLP-1, which is a hormone we all make. And this is a medication that gives you more of that in an injection. There's also an injection that is GLP-1 and GIP receptor agonist, so dual and has kind of more targets in the brain. And the kind of weight loss that these medications drive is far, far better than anything else we have had on the market. And that's why it's so exciting. Also, we have very, very good safety data. The FDA now requires these long trials with many thousands of people looking at a lot of the different safety parameters. And so we can be pretty confident in the data. And we're not just studying the weight loss outcomes, we're studying what happens to diabetes, studying what happens to cardiovascular outcomes, we're studying what happens to many of those other diseases that obesity puts you at risk for. And so what we have is really a more comprehensive tool that doesn't just treat weight, but really has metabolic benefits. So the original indications for an obesity treatment have been that your BMI is above 30. BMI takes into account your height and your weight, and that is how obesity is currently defined: body mass index, BMI above 30. The FDA also allows anti obesity medication prescription if your BMI is above 27, but you already have some of those comorbidities that obesity puts you at risk for. So you already have metabolic disease. This might be fatty liver, this might be having had a heart attack already. And so then at a lower BMI, you have higher severity of disease and you would be appropriate. So those are the indications for GLP-1 for obesity. There are also many medications that are GLP-1s for a diabetes indication. So you have to have type 2 diabetes for that. And now the most recent thing is we're starting to see expansion into other reasons to take GLP-1. So the biggest news has been that because a very large study showed that people who have had cardiovascular disease, including heart attacks or strokes, have a reduction in future events and in deaths when they take semaglutide, one specific GLP-1. A study showed that. And then as a result, the label indication expanded, and now it is prescribable under FDA guidelines for people who have had cardiovascular disease for secondary prevention. And Medicare now covers that. So, all of this is really important news in this space and just really underscores how we're thinking about this as a health issue, not a cosmetic issue. And these drugs are driving tremendous health impact, but they're very expensive.
Yes, and let's unpack that a little bit, Florencia. One of the thing that employers are struggling with right now is the cost. I think we should just state that most employers are covering them for diabetes, right?
Yes.
And what we're seeing is the explosion in people that are using it for an indication of weight management. And what the employers are struggling with is the return, right? Always, as employers look about their healthcare investments, return on investment is always an important component. And this is an area where, even though you reference the research and the studies, like, when is it going to be ready for prime time with employers to model, right, the return? And we're not there yet. And what does that look like? And how do you see that playing out? And what's the timeline for employers to do that ROI analysis, which I think will show that there's real value here, but we need data to make those decisions. I'd love your thoughts about when is that coming, and how should employers think about that?
Yes, and this is definitely the key question. I do want to highlight something really interesting that you said, which is that everybody seems to cover them for diabetes, but not for obesity. We're still living with a lot of inherent bias towards obesity as a disease. Even I explained that Medicare now covers the same drug for cardiovascular disease, does not cover it for obesity indications. So we still have that there, and it's something as a society we need to continue to evolve. So the question that you're asking is very, very difficult, and I wish I had an easy answer, but unfortunately, I don't think that our society does right now. So I think, through explaining a little bit how form is helping employers to do this, I think we can get at some of the important answers. The first thing is that obesity care does not equal GLP-1 receptor agonists. And I really encourage employers to think about what are they doing about the disease of obesity in their population, because this is costing everybody a lot of money, not just the drugs, it's the disease. And if people take a look, they will find that people with obesity are hospitalized more. They have more type 2 diabetes, all of the things that drive healthcare spend. So employers have to think about how are they going to reduce the costs in this population. And I think that that's really important. And then the approach that we take at Form is let's help people develop strategies that really work for them. And employers are different, as you know. Some have a tenure that's very short. Maybe they spend a little bit less on sort of preventative strategies. Others have, a tenure of employers that's decades long. And there it can make such an impact to prevent diabetes in your population. You end up paying for that down the road. So there is a lot that's going to be employer dependent. But part of what we really help employers to understand is that you can give a lot of the aspects of obesity care, even if you don't give GLP-1 medications for everybody. And so, what we're really about in this kind of concept of center of excellence is give everybody those lifestyle tools that will help them be successful. For some patients, we can use low cost medications. We do have low cost medications that can be impactful. And for some people, particularly at a low burden of metabolic disease, they can be very impactful or impactful enough to get them to a much better place. And then we can work with employers to really understand the individuals and who is at the highest risk in the population and make clinical decisions to drive this kind of high cost resource, highly effective, high cost to those people with higher burden of disease. Again, this is something that we would work with the employer to understand how, how they see things and kind of offer these different strategies that are clinically driven, because putting everybody on the drug is going to be really expensive and really may not be necessary. And then when you do the return on investment analysis, you can look at different things. We can look at how how making a choice to go with a solution that's all GLP-1 versus going with a solution like ours that uses a much fuller spectrum of tools. That saves you money, right? Because not everybody ends up on GLP-1. So that's kind of one bucket of cost reduction. And then the other really big one is that cost savings from people being more present at work, being healthier, not developing diabetes. If you have pre-diabetes, you have a very high chance of going on to develop diabetes, and you can reduce your risk by 60% by losing 5 to 10% of your weight. And you can reduce it by more than 90% by going on one of these newer GLP-1 medications. So there's a lot of cost saving in prevention and in treatment that's here as well. But you've made a really good point. We don't have all of the data that we need. We do have some data, and in general, the data does support that it's the sicker metabolic patients or employees, higher burden of disease, higher BMI, more comorbidities. That's where we do generally see the greatest return on investment because we can save the healthcare dollars from all the other diseases.
Yeah.
Well, we so still I agree with you, something that we need to, continue to understand and see where the savings are because these medications are so new and they're so much more effective than ever before. We really need updated data and we do work, very closely with employers to make an individualized strategy as I said before and also these calculations, based on their own population. And I think this is where we are right now today, that there isn't one global answer that fits everybody, but that different employers, based on their population, based on their values, their means, a lot of different factors going into the equation. But we feel that we have this kind of unique ability to work with people and develop a plan together with the employer that can help them deliver really great care for obesity as a more global program than just, selling GLP-1s and put all of these factors in that help them develop a program that works for them.
So this point about the population an employer has, I think makes a big difference in how they think about covering these medications. We have one employer, for example, who is in manufacturing and they have employees for a long time and they have employees that are on their feet a lot and doing physical labor. And they intuitively know and think that when you lose weight, it's much better for your joints, right? You have less knee, hip, joint issues. And because of that, they are covering it. And they don't necessarily have the exact like ROI data where they've done modeling, but they just have said, we know, losing weight is going to help our population. And so that's how they've
Yes.
made their decision. And so we see examples of that where maybe we don't have the data to do the modeling, which is so important for employers, but some are saying, we just know that this helps.
And I'm so excited for us to lead the way with this a little bit. The uh, Another example is that Form is having the opportunity to work with an employer where a lot of the employees work in their physical plant and use machinery, and there are weight limitations for safety on employers being able to use machines. So we think, and I'm excited to help people, but also maybe to be able to contribute to research and to understanding about this. We think that by driving weight loss, they may be having employees who are now able to do an expanded job responsibility by using the machine and also really importantly reduce the safety risks. So again, I think we're in a situation where the financial picture can be complex and have subtleties that it really does make sense to think about this in an individualized way. But also, there's tremendous demand for these medications. So I do think employers are under pressure and they are great tools that, are really driving results for people. But also, this is such an exciting field. There are so many drugs in the pipeline. It just got announced recently that one of the large drug manufacturers is going to be publishing before the end of year their phase 3 results on a new strategy. It's a combination drug that's expected to be better than anything we have. And so drugs in the next 3 to 5 years are going to be coming out, targeting the GLP-1 pathways, also other pathways. And so people are going to need a strategy and they're going to need, we want to be a partner that can help them treat metabolic disease and obesity as this field is rapidly evolving, not just find a way to, put GLP-1s on the formulary or not.
Yeah, let's hope that those new entrants will bring prices down. You
Yes.
you mentioned demand, so I wanted to ask you about how the demand for these medications has changed the way physicians treat patients who struggle with obesity and your perspective on that.
This is such a great question, and the answer is a lot. So, from a scientific perspective, it's just tremendous to see this kind of science come to the bedside, as we say, from bench to bedside, and to really have drugs that are not just able to help patients lose 3 to 5% of their weight, but are able to help patients lose 15 or 20 or more percent of their weight. And we are seeing results with drugs now that compare to the surgical results, and that's without surgery. And so that is phenomenal. So I think there's tremendous excitement from a scientific perspective. What has also changed a lot is patients coming into the appointment with a specific treatment plan in mind. And this is sort of unheard of. My patients never walked into a diabetes appointment or a high blood pressure appointment saying, I want this medication at this dose, and I've read up on it, and all of these things. And now that's exactly what's happening. People are seeing all of the huge media coverage on this, and they're walking in with very specific, requests. And so it is changing the dynamic between the healthcare providers and the patients, the healthcare professionals and the patients. And in some ways, it's very positive. People should be empowered. And believe me, for people who have struggled with obesity, sometimes their entire life, and most people in that bucket have tried everything, to know that there is something that could really help them change their biology and therefore allow weight loss is really, really exciting and life changing. And so we get it. But it also really is a different dynamic when people come in with a preconceived notion. And honestly, it's a challenge then when we don't have coverage for these medications. But we really, help people understand. Our work on the healthcare professional side is to really help people understand that these are serious drugs. They're not right for everybody. We have to do all of the very careful workup to really understand how weight is impacting someone's health. And we have to make sure this is the right treatment and at the right time. And so that really requires working closely with someone who understands what they're doing, who has experience using these medications. And very importantly, it's a partnership that evolves. Again, it's not that give you a prescription and go on your merry way until your physical next year, because a lot of these medications require titration. Sometimes we start with something and we have to switch because not every medication works for everybody, which is important. We don't want to be keeping people on expensive treatments if it's not effective for that individual. So we have to really be looking at what's happening. We also don't want to keep someone with terrible side effects on a medication. And so we really have to think of this as a partnership between the healthcare professional and the patient, and making the right decisions and evolving them over time.
Yeah, and that really leads to my last question, this idea of monitoring over time. Um, do we know the long-term effects of being on GLP-1s at this point? We recently had Marty Makari join us for a breakfast and promoting his new book, Blind Spots. And just in
Mm.
passing, we didn't dig in, but just in passing, he talked about GLP-1s potentially causing brittle bones and other things long term.
Mhm.
And I'd love any thoughts you have on what happens to us that if we are on those medications for the long term. Like, do we know?
That's such a thoughtful question. And I think in many ways we don't know enough, but we do know a lot. So the FDA approving a medication requires at least a 2-year trial. And these medications are being approved for long-term use. And as I mentioned, we do have patients on this class of medications since 2005 when the first one was approved. So that's decades of experience with these medicines. And to be honest, what's remarkable is there are so many safety studies, there are so many outcome studies, and they are so positive. And it feels like every time we sort of round the corner, there's a new benefit. We're learning this class of drug may have benefits for substance use disorders. It may have benefits for some neurodegenerative diseases. It is, now approved for cardiovascular disease prevention in people who have had it. So we are learning more and more about the benefits. It's very remarkable. Now, drugs always have risk, treatments always have risk. And your question reminds me a little bit about in working with patients when I've counseled them about surgery or medications is you can't just think about the risk of the treatment. You have to also think about the risk of continuing to have the disease. So you have to weigh the risk, the
Yes.
very, very small risk, some small, very, very small percent of chance that you may have some side effect that's very rare. But if you continue with this disease, we know your chance of developing diabetes is much, much higher, 90-fold higher in some cases or something like that. And so you have to really weigh the risks with the benefits. I think that that's the right way to approach it. Is it possible that we'll discover things that we don't know today? Absolutely. But I feel very, very good about the science that we have because it's so robust. We need to continue, to explore more, and we need to understand better which treatments are right for which patients. I think that's kind of a rich area that we need to continue to explore. And but overall, I'm so positive, and I think that unfortunately, the risks of obesity are so significant in the population, both in terms of the diseases, but also the cost, of society sort of caring. And we know this. This is kind of in the newspapers, all the time too. We're in an obesity epidemic, and it drives so much excess health spend. But I feel really good about the science that we have and the science that we're doing to come up with even better treatments.
Well, I think that's a great place to end our conversation, Dr. Halperin. Thank you so much for your time today. We truly appreciate your insights. And I think one of my big takeaways is that employers shouldn't let their employees just figure this out on their own, that we should wrap around support for employees, whether it's a form, there are other solutions out there. PBMs are offering solutions, but the idea that employees should have support as they are considering these medications to also focus on the other things like nutrition, like exercise, and it should really be a comprehensive approach.
Yes, and geared towards driving better health, not just a specific number on the scale. I love how you summarized all of that.
Yes. So the resources that were discussed today, Form Health and others, are going to be found on our podcast landing page on our website at www.stlbhc.org. And thanks for listening to Be Health Connected, empowering healthy workforces one conversation at a time.
Thank you for listening to the Be Health Connected podcast. For additional episodes or to learn more about employer resources available through the St. Louis Area Business Health Coalition, please visit www.stlbhc.org.